Well, when I walk into a patient's room, I introduce myself, of course, because we're not, of course, like your average medical center. We have the holistic approach to healthcare, and which includes your mind, body, spirit. So we want to make sure that everybody is taken care of. So, of course, when I walk in, I introduce myself because it's not natural if you're coming in for an earache to see a social worker. So,
you know, over the last few years, there's been a bit of a culture shift, or at least an attempt at a culture shift to get people to view mental health and substance use as, you know, part of the whole person, right? And so they're not these separate entities, and the people are not viewed as, you know, oh my gosh, it's those people, right? Those people with addictions, those people with mental health problems.
So going in, I just introduce myself and make them aware that we have behavioral health services here at the agency, and that we, you know, are interested in making sure the whole person is being treated when they come to our agency for services. That we're not just focusing only on medical, that we also look at mental health and you know, whatever needs that they may have that we can help them with. So just, you know, looking at the whole broad picture of the services that we offer first with them, and then kind of zeroing in on how we might be able to help them with whatever's identified through the SBIRT screenings.
The patients here are offered what I call a full person care. That care addresses things that go from dental all the way to every and any medical issue that they could come in with for physical health. Then when you add in the screening for the SBIRT and the GIPRA program, that allows us also to capture any drug abuse, alcoholism, and or any depression as well, or mental health. We also offer services here on site for therapists on hand, as well as AOD counseling and grief counseling.
Well, if you don't help people deal with their stress and anxiety and all those kinds of things, you're really only treating half of them, you know, if that much, you know, because people are complex, as you know, there's the whole mind, body, spirit, and all that kind of stuff. And if you're only treating that one part of it and not, you know, talking to them about, well, why is it hard for you to take your medications, or, you know, how come, you know, you don't try to do something to change your situation if possible, you know, then you're sort of shortchanging them, really.
If they just have primary care and you add that behavioral health aspect, then you are going to be offering to help the whole person. They come in with a medical problem, but then they see, oh, they care about my whole person. They care that I might be depressed. Instead of just, you know, writing me a prescription, they're going to send me to a therapist who can help assess the whole situation and can start helping me. So a combination of medication with therapy, I mean, it's just, you're just going to be hitting it from both angles.
Once you get them here and they're in an environment that they know that they can come here and get services from whatever aspect of their health that they need, makes it easy because all they know is they just need to get here, and then we can hopefully take care of them.
So that's another piece of it is actually trying to achieve that culture shift. So once you have the program up and running, that's what the nice thing about SBIRT is. It's very kind of very non-invasive way to actually get in the service lines and show how those three areas can actually, they do actually blend together, right? The physical, mental, and chemical substance abuse realms.
Yeah, I think everybody learns more about the patient as a whole because of this process. There's like, staff is talking to each other more because of this, because they're forced to because of the workflow and the small environment that we work in, but it's a good thing because it's helping the patient. So yeah, I think it's improved staff interaction, it's improved our interaction with the patient. I think people realize that we have a service kind of unique than others, because before I don't think people realize I can go to my doctor and I can talk about like my diabetes and things, but I can also really talk about depression right here, and it's all in one place.
Patients coming in to get, you know, shoulder looked at or a foot fixed or something like that, and then finding out, oh wow, you offer these other services or opportunities. Yes, absolutely. You know, as I stated before, we're here for the whole person, not just one particular thing. Having patients having experiences with their primary care physicians in other places where when they open up to them about grief problems, they were having depression problems, unfortunately that provider at that particular location just told them, we'll deal with it. So that caused them to basically not get any treatment, including for their diabetes and other mental, physical problems, including their depression, for over 3 years. To coming back and then coming in here for something completely not related, and then get an opportunity to meet one of us to work with them and help them find counseling.
It's just a different way of doing things, and I think that holistic approach is just so crucial to people's care, because I have found, and research has shown, that medical and mental health, they go together. Physical health and mental health go together. If oftentimes your physical health is bad, then your mental health is gonna go, you're gonna get kind of down in the dumps a little bit about it and struggle with that, and vice versa. So if you have mental health, you don't often take care of yourself physically. So offering all of that under one roof is I have seen that it has really helped people, which has really encouraged me to even enjoy it even 10 times more. So.
And I love, being a behavioral health therapist, I love the fact that it's hitting the whole person. You're dealing with the health issues upstairs, and then seeing if there's any depression, or in the behavioral health, we add an anxiety questionnaire, we add a mood questionnaire regarding bipolar, and then of course the alcohol and drug. I mean, we're hitting every aspect. Can't go wrong with SBIRT.
That doesn't mean to say that that's the only thing that you focus on, but people are not scary. They are messy, and it can be difficult at times. However, I think that by having the SBIRT system in place and the ability to address depression, alcohol, drug issues, you're going to benefit your patients more in the long run, even if it seems difficult in the short term, especially for you in terms of what you get into. Because you start asking those people those questions, and they get difficult. It gets messy. But don't be afraid of the messiness.
Patients just realize it's a part of the process of going to the doctor. But they ask about this.
Makes sense. Yeah. It's
Treating the patient as a whole.
Yes, we're treating the patient as a whole.
Holistic care over here.